Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Question 25. You hear a nursing handover in pediatric ward. Now read the question.
First up is Oriv, a 3-year-old male admitted overnight with a diagnosis of bronchiolitis. He's had 3 days of low-grade fever, cough, and increased work of breathing. Parents brought him in due to concern about lethargy and reduced oral intake.
Okay.
Vitals on admission: respiration 44, O2 saturations 90% on room air. He was commenced on low-flow oxygen via nasal prongs. Auscultation revealed widespread wheeze and crackles. Chest X-ray showed hyperinflation, no consolidation. He's on supportive care, no antibiotics initiated, as it's presumed viral. Feeding has been a concern. He's only taking sips orally, so 4 fluids were commenced to maintain hydration. The mother is staying with him and has been educated on suctioning his nose before feeds. Monitoring respiratory effort, O2 requirements, and hydration status will be key. We'll reassess escalation need this evening.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
I want to take a moment to emphasize the importance of mental health monitoring in our daily care routines. Emotional well-being is just as vital as physical health, particularly for our residents who may be experiencing feelings of isolation, anxiety, or disconnection. Every interaction we have can make a meaningful difference. To support this, we've recently implemented a daily mood chart. Please ensure it's being filled out consistently and accurately. It's a simple tool, but it can help us spot patterns and intervene early. Pay close attention to even subtle changes in behavior, such as reduced participation in group activities, shifts in sleep or eating habits, or increased emotional withdrawal. These can be early indicators of depression, cognitive decline, or other health concerns. If you observe anything unusual or concerning, please report it promptly so we can follow up with the necessary care and support. And don't underestimate the power of conversation. A few minutes of genuine connection can do wonders for a resident's mood and overall well-being. Whether it's a friendly chat, a shared story, or a moment of laughter, your presence matters.
Question 27. You hear a surgeon talking to a post-operative patient. Now read the question.
Good morning, Mr. Ray. How are you feeling today?
Morning, doctor. I am a bit sore, but otherwise okay. Just a little anxious about the recovery process.
That's perfectly normal. You've just been through a major procedure, and your body needs time to heal. The soreness is expected, but we'll manage it carefully with your medication and movement schedule.
How long will it take to feel like myself again?
It varies from person to person, but generally, you'll start feeling significantly better within a couple of weeks. Full recovery might take a few months depending on your activity level and how closely we follow your post-op plan.
What should I be doing and not doing?
Question 28. You hear a consultation between antenatal mother and a GP. Now read the question.
So, Mrs. Khan, have you had a chance to think about your birth plan?
Yes, I've been going through the options. I'd really like a water birth if possible. I've read it can help with pain and make things feel calmer.
That's a great choice, and it's definitely possible at the birthing center. They have the facilities and trained staff for that. Just keep in mind, if any complications arise, you may need to be transferred to the hospital.
That's fine. I'm open to that if needed. I just want to try for a natural birth, without an epidural if I can manage it.
Absolutely. We'll note that in your plan. It's also helpful to think about who you'd like with you during labor, and whether you want delayed cord clamping or immediate skin-to-skin contact.
I'd like my husband there, and I definitely want skin-to-skin straight away.
Perfect. I'll update your notes, and the midwife will go over everything again at your next appointment. It's good to stay flexible, but having a plan helps everyone support your choices.
Question 29. You hear a pharmacist talking to hospital staff. Now read the question.
In pediatric settings, responsible antibiotic use is crucial to ensuring long-term health outcomes and minimizing resistance in vulnerable populations. This briefing underscores the importance of selecting antibiotics based on culture results and favoring narrow-spectrum agents when treating children. Dosing must be weight-based and age-appropriate, with careful monitoring for side effects, including allergic reactions and gastrointestinal disturbances. When feasible, switch from intravenous to oral formulations to reduce complications and ease administration. Frequent reassessment of therapy within 48 to 72 hours is essential, as pediatric patients may exhibit atypical responses. Engaging in stewardship activities such as case reviews and interdisciplinary rounds can help refine treatment plans. Staff should educate caregivers on the need to complete prescribed courses and discourage self-medication or leftover use. By applying precise, child-focused strategies, we can protect young patients and preserve antibiotic effectiveness for future generations.
Question 30. You hear a physiotherapist briefing hospital staff. Now read the question.
Effective patient handling is critical in preventing musculoskeletal injuries, particularly to the shoulder, a common area of strain among caregivers. Staff should avoid lifting patients using outstretched arms or repetitive overhead movements, which place undue stress on the shoulder joint. Instead, they should use assistive devices like slide sheets or transfer boards, maintain a neutral spine, and keep the elbows close to the body to distribute load safely. Training in safe patient handling techniques, including pivot transfers and body mechanics, should be conducted regularly to reinforce these principles. Whenever possible, caregivers should work in pairs and communicate clearly to avoid sudden or uneven shifts in patient weight. By adhering to these strategies, we can reduce the risk of shoulder injuries, improve patient outcomes, and foster a safer care environment.